so that is the other diseases that we see in horses, and these are something that is even more unknown, and we know less about the causes, less about how to diagnose them, and certainly less about how to treat them. There are some very similar factors in diseases of the hindgut to the gastric acid, the stomach ulcer situation in the foregut. But not all of them are exactly the same, and certainly the treatment options are much less and not as effective. So let's just talk about some fascinating facts about horse digestion. And so anthropomorphize horses. What does that mean? It means we tend to think of them like they're little humans or big humans, okay? They're horses, they're not humans. So they are actually a lot happier without rugs on and healthier without rugs on. They're much happier out in the paddock than they are locked in their stables. They're much happier eating and running around and getting dirty than they are having baths and staying in stables and being pampered and rugged and groomed and everything else. They certainly aren't so happy from their gastrointestinal system of just getting 2 or 3 feeds a day and then, 8 hours out on the pasture, then locked up the rest of the time with a hay net that they can gobble down very quickly. So they're not humans, and we shouldn't treat them like humans, we should treat them like horses. That's not easy for everybody in this room. Okay. And their digestive system obviously is very different now. So if you understand horse digestion, and I've given you quite a bit about the stomach digestion, and we'll start to talk a little bit about the hindgut digestion. Remember right at the start, I said to you that the largest part of the horse's bowel is the hindgut system, not the stomach, which we've just focused an hour on, and stomach ulcers and so forth. That's a small volume. Has a very vital, important role. It gets diseases. We can see diseases and we can treat diseases in them. But then this whole rest of the bowel that has a really important role in digestion that we know very little about in terms of its diseases. But what we do know is that the more you take the horse away from its natural behaviour and what it's evolved in lifestyle-wise to live, then we get problems. And like someone very cleverly invented a 3-metre endoscope and started to look for stomach problems, unfortunately the 3 metres doesn't get you beyond really the stomach in a big horse. In a little horse you might be able to get into the duodenum and a little bit further, but you certainly can't get into the large bowel or much of the small bowel or the colon or the cecum. We can't get inside those. Not like you can with a person, where you can go down periscope and up periscope, and you can swallow a little camera and it'll swallow it, and then a day later out it comes and you catch it. You give it back to your gastroenterologist, and there's a full Hollywood movie of what's inside. We just can't do that with horses. The technology's not there. I think it'll come one day. We can't really even ultrasound or X-ray or image. There's no real modality that we've got. Even MRI, CT, the horses are too big to fit in the machines. The technology's not there to be able to lie a horse on its back or standing and scan it from tip to toe with an MRI like we can with people. I think it'll come one day, and New Bolton Equine Clinic in America, they've got this pretty fancy robot thing that scans the complete horse. But I still don't think it has the power or the energy to go deep inside the abdomen. And even taking an X-ray of a horse's abdomen is very difficult because they're just too thick. We do not have the power of an X-ray to get through them. So it's a whole area that we only examine on post-mortem, which is really depressing if you're a vet. It's great if you're a pathologist, that's what they do for a living, but if you're a vet that's not a pathologist, then it's pretty disheartening that all you can do is look at the large bowel and the rest of the bowel via pathology, so via the dead horse. So, what else is some interesting facts? So I've mentioned this before. The horse shares some common features of human and dog and cat digestion, especially in the younger phase, that foal phase, but they also share a whole lot of digestion similarities to the ruminants, the cattle, the sheep, and the deer and so forth, because they eat the same food. So that makes sense. They produce 35 to 40 litres of saliva per day, and we've discussed how important that is for neutralising that acid. The esophagus is a one-way thing. So once it goes in, it doesn't come back up again. So horses don't vomit. They can reflux, which is different from vomiting. Refluxing is where there is so much pressure in the stomach that it just comes back up. It's not an actual voluntary or an involuntary reflexic vomit. And when your horse is refluxing, it means it needs to go to heaven, because most horses that reflux have got a severe small intestinal or gastric problem. They're usually colic, a twist or something, that's not allowing the stomach to empty. And as we've talked about, the stomach empties how quickly? Very, very quickly, especially water and fluids. It empties those very, very quickly. So if you're giving a horse a drench and it's still there, 20 minutes later, it's because it's blocked, the system's blocked. And if horses could vomit, like dogs and cats and pigs and so forth, they would live a lot longer, and we'd be able to manage colic with them more easily than what we can now. Unfortunately, that's a very bad design flaw that horses have with respect to their stomach and being able to vomit or not. So as I said, 15 minutes, it moves on, water, and most of the digestion and absorption of sugars and proteins, starches and proteins and fats occurs in the small intestine, and then we get this hindgut fermentation process to produce volatile fatty acids. And those volatile fatty acids are also absorbed through there, and that also is part of the digestive process. So they have a digestion process in the small bowel of the stuff that they can virtually suck up straight away, and then they have this ginormous big large bowel and cecum that is a fermentation chamber. It's a home brew for all that fibre and the sugar as well to turn into something that the horse can utilise. They don't have a gallbladder, so they don't produce bile like other animals do. And so the role of bile is to secrete into your bowel to add to the chemical mixture of digestion, to enable digestion of food products. Horses don't have that, they don't need it. They can rely just on their small intestine to do the job. And if any really sugar, pure sugar or pure starch gets into the large bowel, we get this overloading of that fermentation process, that homebrew chamber inside the horse's abdomen, and that causes a proliferation of really nasty bacteria, really toxic bacteria, which can cause colitis, which is a very nasty infection and diarrhea in the horse that is often fatal. So the sugars need to come out first, and then all the fibre, and that is digested and fermented, I should say, in the large bowel. The cecum, unlike other animals, is very, very large in the horse. And our appendix is very small in relation to our large bowel size. The horse's cecum is ginormous. And because it is a one-way system, so what goes in there has to come back out again. It's not a throughput system. The cecum is a design flaw in horses, and it's very prone to impactions. And most feed impactions we see are in cecums, and we also see sand impactions in cecums as well. But as I said before, that's mostly related to hydration, so the lack of drinking or too hot weather. So we do see food impactions on days like today, as a result of today, and very hot days. Okay, we've talked about fermentation, and part of that fermentation, that process, is that horses have this poorly understood microbiome inside their bowel. So that's a combination of yeasts and bacteria and protozoa that are in certain ratios depending on the feed they're getting that allow them to ferment away without producing health problems for the horse. When that biome gets out of balance, we either have bad bacteria, not enough good bacteria, don't have enough protozoa, a lack of yeast, or too much, then it gets out of balance, and we see some of the diseases that we'll talk about of the large bowel now. A horse's gut sound should be noisy all the time. Okay, so we call those borborygmi or gut sounds, and we like to hear those by a stethoscope, but often you can just hear your horse's tummy gurgling over standing. That's really good. You can hear your horse's stomach. It's working very, very well. We like them to have lots of this roughage, which we talked about before. So just to sort of quantify it, you need about 7 kilos of roughage for a 450 kilogram horse per day. So 7 kilos is quite a lot of roughage of hay. Hay doesn't weigh very much, so it's about quite a big volume. And whatever a horse eats now takes about 36 to 72 hours to come out the back end. And if a horse has got an impaction or a slight blockage, it can take up to 5 days to do that. So if your horse is sort of bit off food and you think it's colicky, then you see a poo, you go, well, that's all right, he's not blocked up. That poo was eaten 2 or 3 days ago. So that's just a history. So don't assume that your horse can't have an impaction just because it's done a poo today. And you know, what goes in this end has to go about 36 metres all the way through. And that's why we can't visualise it. We don't have a scope that's 36 metres long. And if we did, it would be too impossible to get it to wiggle all the way through. Okay. So we've sort of discussed that mostly, but that's basically how the bow sits. And you can see very small stomach, large bow. On the other side, and it's just lifted up, is on the right side of the horse is the appendix or the cecum, and then a short rectum. So ulcers, now we're going to talk about hindgut ulcers, because this is something we do know a little bit about in terms of hindgut disease. So these are essentially, we believe they're similar in look and pathology to stomach ulcers, but we believe they have a slightly different cause. The pathology we are not 100% certain on, but we believe it's related to, again, acidity, a high level of acidity in the hindgut. So in this case, it's characterised as hindgut acidosis. And I believe over the next 10 to 15 years, our knowledge in this area and how it's affecting our horse's health will expand dramatically. There's some very, very clever researchers, including a guy who I know quite well, Derek Nottenbelt. So if you want to know, to Google someone who's at the world forefront of hindgut acidosis and hindgut disease and ulcers in particular, his name is Derek Nottenbelt. It's Nottenbelt with a K. He's a very famous English veterinarian, and he's a friend of mine, and he's the guru on this stuff. And he has a really good video that you can have a look on YouTube where he talks about what we're going to see in the future with the diagnosis of hindgut disease, what he believes, and I think he's 100% on the money. So, and he is actually a little bit frustrated that the whole veterinary community and the whole veterinary ownership is really focused on stomach ulcers, stomach ulcers, stomach ulcers, stomach ulcers, and we're just missing the whole lot of disease is probably equally as damaging or affecting our horses that's in the hindgut that we're not looking for, we're not even thinking about. It's out of sight and it's out of mind in his view, and he worries that if we don't focus on this, we're gonna see more problems that could have been prevented. So we're going to talk a little bit about what he thinks and today, and what we are doing with the diagnosis and management of hindgut diseases. So we know that one cause of, or one classic disease of hindgut ulceration is called right dorsal colitis. So it's for some reason in the right side of the colon and the upper bit, the dorsal bit of the colon, we see ulcers that we believe are primarily attributed to phenylbutazone use. So high levels of but for prolonged periods of time. So, and we believe that there is a similar system that's of protection against acidity or whatever's causing the ulcers in the hindgut that is disrupted. That protection mechanism is disrupted the same way, perhaps, in the stomach that it does in the stomach is being disrupted in the colon. Why the right dorsal colon? Still don't know. Why not other parts of the colon? Why not the cecum? Why not on the pelvic flexure, some other place in the large bowel? We still don't really know, but there is this hypothesis that the mechanism of action or the toxicity, it is a toxicity of bute, a side effect of bute administration, the hypothesis is very similar to stomach ulcers. And it's a very serious disease. Right dorsal colitis can produce quite a lot of problems with horses, a lot of sickness, and even death, unlike stomach ulcers. It can be a very, very nasty ulcerative colonic condition to get for a horse and cause severe colic and death. Interesting, I've only seen it a couple of times with 100% certainty, and it's always been in horses that have tremendous amount of pain. So you can have horses on bute that are not in too much pain and then have them on the same dose of bute but high levels of pain, and they're more prone to right dorsal colitis. So the fact that they're in pain itself is a contributing factor, not just the bute itself. So when we see horses with fractures of their pelvis, fractures that are very painful, acute, long bone fractures of the radius that are non-fatal, so the ones that we can treat, and we usually treat them with confinement and strategic use of anti-inflammatories, where unfortunately we try and give them very much less phenylbutazone as a pain relief because we don't want to induce a right dorsal colitis. So we're a bit hamstrung with pain relief in those horses to try and prevent dorsal colitis. At least in people now, and I don't know, Jules might be able to help me with this, but in small animals we think that the newer COX-2 anti-inflammatories like Metacam, and there's a few others that are now released, many others that are Firocarb, and you'll know them all, Jules. We don't have them yet for horses. The one that is registered and available for horses is Meloxicam, a very good anti-inflammatory, and theoretically it should have because of the way it works on the inflammatory pathways, in blocking the inflammatory pathways, it shouldn't block the same pathways that bute does, and should, in theory, not predispose to stomach ulcers, and in fact then it may not predispose to right dorsal colitis if we use it. So certainly in foals we tend to use Metacam rather than bute to reduce the risk of ulceration, and in horses that need pain relief, that's a good strong pain relief, but we're worried about this colitis situation, then we would use Metacam. However, it's not been proven that it is protective in horses, and I'm not sure, has it been proven that it's better in small animals? Yeah, it's definitely better in small animals. The big problem with it in horses is it's very expensive, because the dose you need to give is a lot bigger than a human or a dog, and there's only one company making it, and they're going to charge what they want for it, unfortunately. But we do use it. It's available by injection, and it's available by orally as well in a paste. Okay, let's move on. So parasites are definitely thought to play a role in ulcers in the hindgut. So this is different from stomach ulcers. I talked a little bit about bots that might have a role in stomach ulceration, gastric ulceration, but we're not really convinced that bots are a huge factor in stomach ulceration, but definitely parasites. So these are the large strongyles mostly. So these are the worms that you will see in your horse's manure after you worm them, the long round ones, and tapeworms. So roundworms and tapeworms are the worms. We believe that their primary hook attachment into the mucosal lining of the large bowel is definitely a factor in some of these hindgut ulcer situations. So that's not related to acidity of the hindgut, but it's physical trauma to the hindgut. So this is where we see most of the parasites. We see bots and hebronema in the stomach. Sue's going to cover this a bit more after me. Pinworms in the rectum and anus, perineal area, which we don't see that commonly. Small strongyles and ascarids, some tapeworms we see in the small bowel. Generally speaking, they're microscopic worms. They're quite dangerous, those worms, especially in young animals, and they're more life-threatening than worms, the larger strongyles and the tapeworms in the hindgut. But these, we believe, can contribute to hindgut ulcers. And then hindgut acidosis. So we see, we believe, and Derek Norton-Belt believes, that if we do get an overload of starch, not enough to cause that crazy fermentation process that causes the severe colitis and infection, and usually it's a clostridial organism that does that, but we do get this increase in acidity, similar to what we get in the stomach, and we're getting hindgut acidosis. And the hindgut acidosis is not really thought to itself irritate the acid. We don't think irritates the lining of the bowel like the acid irritates the lining of the stomach, because all of the bowel has got enough mucus on it to stop that. But what we believe the hindgut acidosis does, unlike the stomach, is it totally disrupts the fermentation pH, and we get growth of nasty bacteria and death of the good bacteria that are needed to digest and ferment the fibre and starch, a little bit of starch that's there. And when they die, they release endotoxins. And those toxins in the bowel, we thought, are part of the process that irritate the lining of the bowel. So not the acidity itself. The hindgut has an acidity problem, we believe. That doesn't directly irritate the bowel, but it kills the bacteria. The dying bacteria release toxins. Those toxins then can cause the the hindgut ulcers, but also the disruption of that produces poor digestion. So it produces the poor fermentation, irritability in the stomach, more gas than probably normal, irritability in the horse, and sometimes diarrhea. You get some similar signs that you would get with foregut, with stomach ulcers, gastric ulcers. But the pathology, we believe, is quite different. So it's about maintaining or disruption of the healthy bacteria and fermentation environment, that balance between the lactobacillus type bacteria, the yeast, and the protozoa that are there. So those nasty bacteria that grow in the absence of the good bacteria, because they've all died, they attach themselves to the blood vessels and the lining of the bowel as well, we believe. They're attracted to iron, and that process itself. So the good bacteria that have died release toxins, which damages the lining of the bowel, and now we believe the bad bacteria that have taken their place also damage the lining of the bowel. So we believe, and Derek believes, that the most common cause of this whole upset is definitely related to feeding, primarily feeding. Less so stress, less so those other factors like exercise that I talked about before, and chewing and things like that. This is about what you're feeding, not necessarily how much you're feeding or how often you're feeding. It's about what you're feeding is the factor involved here. And again, it's very similar. It's a lack of fibre, lack of those chewy foods, and the lack of a source for the good bacteria to thrive on. Good bacteria in the digestion process in the hindgut require lots of fibre, lots of low quality fibre. We believe that there's probably a lot of horses out there, and certainly what we're doing with our testing is that we're seeing a lot of horses that do have abnormal faeces on test. There's some limitations to that testing, but they have signs of hindgut acidosis, and we're starting to treat them with the medications that we've got, and we're seeing some quite interesting results. So how do we identify hindgut or colonic ulcers? Well, we're looking for, as I said, similar signs in your horse, but probably anemia is more of a factor. We don't tend to get anemia with the stomach ulcers. They tend to bleed enough or lose enough blood through those ulcers to get an anemic. But they do, we believe, in the hindgut. They can lose enough blood in the hindgut to get a low-grade anemia. So very similar signs: lack of energy, irritability, resistance under saddle, weight loss, and things like that. So how do we diagnose it? As I said, we can't see it. The blood test isn't a great, reliable test for it. The horse can't tell us it's got an upset hindgut. So we go to what is the product of the hindgut, which is the manure. And manure, we're hoping, will tell us a lot, but at the moment, it's still not 100% certain what it's going to tell us. But there are two tests that we do routinely. One of them is a Succeed test, which is a test that Derek Nottenbell has been involved in developing. And it's testing for albumin in the manure of horses, which is a leakage protein, which tells us that there shouldn't be albumin or high levels of albumin in your horse's manure. If it is there, it's come from somewhere. It's probably come from the blood or leaking through the mucosal barrier, the lining of the bowel that's not working properly, that's damaged, compromised. And then it's testing for hemoglobin. So it's testing for actual blood. So blood in the the hemoglobin that's carried in red blood cells, so leakage of blood, which might indicate, which you wouldn't have in the stomach. When blood leaks in your stomach, the acid breaks down the red blood cells and breaks down the hemoglobin. But in the large bowel, you'll get blood come through. You won't see it because it's in trace amounts, so this test is quite a sensitive test. It's like what we call an ELISA test. There's still a lot more research to be done about how to apply the results from it, but it's one of the tests that we're using as an indicator, and we're using it in conjunction with the clinical signs of the horse and the history of the horse and what the horse's manure looks like. The other test that we do is a fecal pH test. So when there's hindgut acidosis, there's some evidence to show that their fecal pH, so their manure pH, will be low, too low, acidic. We want it to be high. So we can very easily, in our practice, we have both these tests and we can do them within 10 minutes. We can test for the pH, and we want a pH of 7.5. And most of our horses that are coming in that we believe have got problems with hindgut acidosis or hindgut disease are having pHs around 5, 6, even as low as 4. And that's really not normal in our view. And we treat them, and we actually find with the treatment that their pH is going up to this optimal level of 7.5 and above. 8 or 9 is really good, and we're seeing a difference with these horses.